Cataracts can usually start to form 50s or 60s and will continue to progress, but you may not notice symptoms until you're in your 70s or 80s. Sometimes certain medical conditions can accelerate your cataracts, and you may need cataract surgery earlier in your 40s or 50s as well. Smoking can definitely accelerate the cataracts. Other medical conditions such as diabetes can also accelerate the rate at which your cataracts grow. Trauma to the eye or having cataracts when you were born at a young age called a polar cataract can also be a reason why you may have cataract at a young age. We don't like to do cataracts at the same time. We only reserve that for very rare special circumstances. Most patients get one eye done at a time. Typically, we only do one eye at a time. We like to wait until the first eye is healed before we move on to the second eye. That can be anywhere between 2 to 4 weeks. There's no such thing as a perfect lens. There are pros and cons to every single lens. And again, it really depends on what the patient is looking for after cataract surgery, as well as different pathology that they might have in terms of their eyes and things of that sort. When a patient comes in for a cataract evaluation, the doctor will take a look at the cataract and say if the cataract is ready or not to come out. If you decide to proceed with cataract surgery, the next step is usually to have some measurements done in order to know which type of lens implant to place in the eye, as it is customized to your own eye. During surgery, usually come in and meet the anesthesiologist, as you do get a little bit of relaxation medicine through the IV during the surgery. And then once you're in the operating room, the surgery takes about 10 to 15 minutes. After surgery, you go into the recovery area, and once you're stable in the recovery area, you get to go home that same day. We'll typically see you either later on the same day or the next day for a post-op visit to make sure that everything is healing properly. Patients are extremely happy after cataract surgery. A lot of patients notice that their vision is extremely better, as well as more light is getting into their eyes. Things are brighter. They're able to see more detail and more clarity after cataract surgery. So it's extremely rewarding and gratifying, not only for the patient, but also to the surgeon as well. I can definitely understand why someone would be afraid or scared of cataract surgery, as you've probably never had surgery on your eye before, and that can definitely be scary. I like to tell patients cataract surgery is the most common procedure we do, so we are very well versed in doing cataract surgery. Most ophthalmologists have done thousands of cataract surgeries, and the procedure is pretty quick, only lasts about 10 to 15 minutes, and it's a pretty straightforward procedure that we do that can help ease patients' fear.